Thank you.
Thank you, Chad.
Thank you so much.
I'm gonna.
Thank you.
Okay, bye, Tally. That was great. Thank you. Short, sweet.
Yeah.
Okay, I'll call the program committee foundation meeting to order at 4:33 PM. Is there a motion to approve the agenda? All those in favor? Aye. Move on to meeting minutes from the January 14th. Meeting. Are there any is there a motion to approve the meeting minutes? Or second? All those in favor?
Aye.
Okay, we'll move on to public comment. At this time, comment from the audience may be made on items not listed on the agenda that are up for their public interest and within the subject matter jurisdiction of the district. The committee has a policy of limiting speakers to not more than 3 minutes. The committee cannot take action on items that are not listed on the agenda. Public input may be offered on agenda items when it comes up for discussion and or action. Is there any, public comments at this time?
No problem.
Move on, we'll pass chief executive report since he doesn't have anything or.
You're right.
And we'll move on to old business. Number 1 is the grant payment schedules. Are there any questions regarding the grant payment schedule?
Questions?
Okay, we'll move on to number 2, campaigns and initiatives. A is DPMG Health Mobile Clinics and Operations.
Yes, just a verbal report on that. We are back on track with DPMG Health, based upon the approval of their service contract, that goes all the way through the end of the fiscal year. We're back into scheduling sports physicals, as we draw near the end of the school year. All of the student athletes need to complete their mandated CIF sports physicals for continuing, their involvement in athletics. So, we have already confirmed 4 out of the 10 local high schools, so we're very excited about that. So we'll be starting some of that, and also with that, once again, as the school year comes to an end, a lot of those 6th graders that are going to be going into middle school are going to be required to have their Tdap vaccination. So we are working with all 3 school districts to deploy our pharmaceutical mobile unit, where we approved, the second mobile unit, also the build out of the hub that included the pharmacy component. And now the DPMG Health staff have access to the Vaccines for Children program, which is a federal program that covers vaccines that are needed by our students here locally. So we're very happy to now have that access through our investment into the second mobile trailer and the hub with the pharmaceutical components. So now they're able to have access, once again, like I said, to those Vaccine for Children resources. Yeah, that's pretty much it on DPMG Health.
Are there any questions for Alejandro or comments? No. Move on to B, Lestanet.
Yeah, that's good.
Free clinic provision.
Yeah, so Lestanek, as you recall, it is our partner who received the service contract to deploy their Vision mobile unit for 12 events here locally in the Coachella Valley. So far, we have completed 4. 1 in Mecca, 1 in Palm Desert, 1 in Desert Hot Springs, and the other one in Cathedral City, where our committee chair participated. We do have 5 more scheduled. We're returning back to Tudor Ranch. As you recall, Tudor Ranch was very instrumental in giving us access to farm workers during the COVID vaccines. He was the first grower that hosted these COVID-19 vaccination clinics. So we're returning back with the Vision mobile unit. We're also going to North Shore Elementary School, and North Shore Packing and Thermal, Coyote Run Apartments. We're co-hosting an event there with the Coachella Valley Housing Coalition. And then we're also going to a recovery home. It's called Jóvenes AA in Sky Valley, where that's one home, but they have a network of homes of individuals that are recovering from substance abuse. and a lot of them need glasses. And they're one of the stops that we go on a monthly basis with our medical mobile clinics. So that's an extension of a service, a specialty clinic that they asked for. So we're very happy to schedule that clinic with them. So great outcome so far. Megan and I are working on a abstract in addition to the work that we're doing, or complementing the work that we're doing with the vision clinics that we are going to be submitting to the American Public Health Association. Chris and Donna reviewed it and we'll be submitting here shortly. We're also going to be submitting some work for the Mobile Healthcare Association once again this year to highlight the work that we're doing with vision clinics. So great work all around, team effort, and we're very happy with the outcome so far with our vision mobile clinics.
Thank you. Are there any comments or questions for Alejandro regarding the vision clinic? No? Okay, thank you, Alejandro. We'll move on to the Pink Journey
I
Foundation.
have a quick question. So we've done 1, 2, 3, 4, 5, 6, 7, 8.
Mhm.
Well, I mean, that's scheduled for this year.
Yeah.
And then we still have the four additional ones?
Yeah, so the four we haven't confirmed, so we have four
Mm.
additional dates that are not appearing on there. We're working on confirming some locations for that, yeah.
Awesome.
Mhm.
Perfect. Thank you.
Mhm.
Thank you, Alejandro. We'll move on to the Pink Journey Foundation, the Women's Wellness Clinic.
As you can see there, I developed infographic for y'all to kind of get a snapshot into the work that we're doing with the women's wellness clinics. This is a combination of the previous service contract that we provided them and the start of the new one, which encompasses the 19 new clinics that we have established with the Pink Journey Foundation and also DPMG Health. So just at a snapshot there, some of the services that we have provided to date. The mammograms, we have done 358 mammograms, 254 pap smears. One of the scary statistics here is the women with no prior screening history. Over a quarter of the women that we have seen at our women's wellness clinics, the first time they have received a mammogram, and 21% of those that have received a pap smear for the first time through one of our mobile clinics. Also want to highlight the insurance status. Over 38% of the women that we are seeing are uninsured. Were insured, I'm sorry, and 62% are uninsured. So we're seeing that possibly that would change with some of the changes in Medi-Cal, Medicare. So it's very, very shocking statistic. And also the women who required a follow-up screening, 8% of the women that we have seen do require a follow-up screening, and 17% of the women that have participated in or have received the pap smear have been called back for that. So yeah, and then we have two upcoming women's wellness clinics. We're hosting one on the 21st here at the RAP Foundation. And then on May 23rd, we're doing one at our latest Soledad in Coachella.
Great work.
Are there any comments or questions for Alejandro?
Just great work.
Thank you.
One of the vaccines that they give, do they give the one that prevents cervical cancer?
HPV.
Yeah, do we do that?
We haven't, but that's part of the history questionnaire that they ask the women when they do
Yeah.
the.
I'm
'Cause-
thinking about their daughters.
Yeah, because you took the word right from up, because it's at a lower age than the women that we see. I think the youngest that we have seen is 23 years old for the pap smear. Yeah.
We'll move on to D, California Care Force, Coachella Valley Health Care Plan.
Yeah, so great event at the California Care Force. As for those of you that don't know, California Care Force, very similar to the Flying Doctors. They participate, they do these pop-up clinics throughout California. We have been a proud sponsor of this clinic. That's a 3-day clinic. This last couple of years, they have hosted it at the Empire Polo Grounds in Indio. And for the first time ever in any of the sites, we have included a women wellness clinic, a women wellness component to this, to this event. In previous years, they were contemplating doing this because of the location where they do them normally in a large warehouse. And obviously for the types of screenings that we do, they're very private. So they were not able to incorporate this, but now having our 2 mobile units and then the Pink Journey Foundation mobile unit, we were able to provide that privacy component that was missing from from the California Care Force event. So as part of the event, we were there Friday, February 27th and Saturday, February 28th. And we were able to provide 74 pap smears that were provided by our DPMG health team. And then 70 screening mammograms that were provided by the Pink Journey Foundation. One of the things that I want to point out, now we're getting some high school students involved from the Coachella Valley High School Health Academy. So they were there doing intake. They were helping DPMG Health doing some vitals, doing blood pressure screenings, etc. They're also helping some of the women, translate and fill out their intake forms. So we are also having some volunteers come and help us. But overall, it was a great event, and the California Care Force CEO was really grateful for us to be involved, and we're hoping to continue this partnership moving forward and providing these types of services. And thank you to President Barraza who attended, and she received a tour of both mobile units, of all three mobile units, and was able to speak with DPMG Health staff and also with Melanie Lewis, who is the executive director of the Pink Journey Foundation.
We haven't seen the mobile units inside. We should go. They're really nice.
Yeah. Okay, thank you.
Yeah.
Is there any, comment or questions from Alejandro?
Then one last thing that I would like to mention is that aside from this events that we're partnering, we're also in conversations with Desert Cancer Foundation, so we could provide on-site mammography screenings during the Alpha Sayas Pink event that happens every year. So we're in conversations with them. Obviously, they have to open up El Paseo at 9 o'clock, but their office is, I believe, is 1 block from El Paseo. So we're thinking of just doing the announcement and scheduling women to have their mammogram done there. We also will have some walk-in spots available for the women that are walking. We'll let them know, like, hey, we'll be at the Desert Cancer Foundation offices with the mobile unit conducting on-site mammography screenings during the pain office. And so as that, those details come, we close up some of those details. We'll let the board know that maybe we can get a team to walk out there during the pain office.
You also mentioned the vision screenings at Desert Art.
Yes. Thank you, Donna. Yeah, we got so much going on. Yes, and Donna has always been a great advocate of individuals with special needs. And she suggested that we, coordinate with Desert Arc and Angel View to do a vision screening event for those individuals. So we are in talks, those 4 events that we still have pending. One of them will coordinate so we could partner with Angel View and Desert Arc. So also give access to those individuals for these vision screenings and classes. So thank you, Don.
Thank you.
No problem.
With you.
Okay, are there any questions or comments for Alejandro? Okay, so we'll move on to program update. Number 1, progress and financial report updates. It's located in the packet. Does anyone have any questions regarding the information provided? Okay, I'll adjourn the meeting at 4:40.
Can I just make a comment? I just really want to thank you very much for supporting staff and when we bring these things to you, and we really, we do that very, very carefully, and thank you for your support and the support.
Absolutely. Thanks for doing all the work. It helped out.
Yeah, thank you. Okay, so
Great
we're adjourning the
meeting.
meeting at 4:46.
Right.
So much work.
14 minutes early. I love it.